If our members are able to come off camera, that'd be terrific. It just helps us gain some additional feedback and connection. That'd be great. And Happy New Year, all. It's great to see you all. And thank you for joining us. And again, always volunteering your time so generously. I am going to start on our agenda. And I just realized I don't have my member roll call sheet here. So I am just going to go through the screen. Well, can we have Addie just go through the screen this morning, Trace? That would be easiest for me.
Yeah, I can. I'll actually just let's just do it on. Yeah, we'll do it quietly on our end. So we'll just keep record. No worries. So let's just keep moving.
Great, thank you. Then I will not have to go through all of those names right now. All right, we are going to move straight to our minutes and approval of minutes. And so, as all of you are aware, we have increasingly complicated minutes and meeting recaps. We have full group minutes and recaps. We have our prevention group, and we have our, well, I'll call them the intervention group too. And so we are going to go through those in individual order. So just a quick show of hands. I'm going to go to the full group meeting minutes first, December 13 of 2023. All of those were sent in your meeting materials. And are there any edits or corrections to the full group meeting minutes of December 13 of 2023? And I'm looking on my board. I see, oh, Brian, is that a hand up, friend?
Yeah, I was just reading through the intervention meetings, and in a couple of spots, I got confused as to, there was just one Brian there, if I remember right, and it was, oh no, there's two of us. Okay, I'm sorry, I was confused.
Sorry, Sergeant Cutter. Yeah, we have Brian from our team and Brian, yourself, and so that's the name spelling difference.
Cool, thanks.
Oh, okay, great. All right. So as of the full group, may I have a motion and a second to pass those meeting minutes as they are written, please?
This is Dennis. I will move to approve the full group meeting.
Thank you, Dennis.
I can second.
Thank you, Beth. And anybody opposed to the passage of the full group meeting minutes? Okay, still focusing on December 13th of 2023. The Intervention Subcommittee. Again, you have the meeting minutes. Are there any additions, corrections, changes that the Intervention Subcommittee members would like to see to that group? Okay, record should reflect. I see no hands up. If again, we can have a first and a second on that, please. From the Intervention Subcommittee, if you were here on that subcommittee.
I can motion to approve.
Okay, thank you, Beth.
I'll second.
Thank you, Elizabeth. Thank you. Anybody who is opposed to the passage of the Intervention Subcommittee meeting minutes? Okay, that motion will pass. Sticking on the Intervention Subcommittee for a moment, I am going to jump to now your subcommittee recap. A little bit different than your meeting minutes because it's actual a narrative of what took place in your meeting on that date. Does that Intervention Subcommittee have any additions or corrections to the recap summary of your meeting? And I see none. If we could also have a motion and a second to pass your recap, summary recap.
I'll motion to pass, Elizabeth.
I'll motion to second.
Great. Thank you, Elizabeth. Thank you, Dennis. Anybody opposed to that who served on the Intervention Subcommittee? All right, that too shall pass. Whew, moving on to Prevention Subcommittee, meeting minutes and summary recap. I'll take them individually. For our Prevention Subcommittee members, are there any changes you would like to see to the December 13, 2023 meeting minutes? I see no hands. Okay, if we could have a motion and a second for that as well, please, to pass those meeting minutes.
This is Ashley Chase. I'll make the motion.
Thank you, Ashley.
This is Jenna Coleman. I can second.
Thank you both. Okay, is there anybody opposed from that subcommittee to the passage of those meeting minutes? Okay, that motion will pass as well. And my Prevention Subcommittee friends, we're moving on to now your summary recap documents. Again, are there any changes that the Prevention Subcommittee would like to see to that summary? Seeing none, if we could also have a motion and a second to pass your summary recap. It may be the same people as last
I will make the motion again then.
time. Thanks, Ashley.
This is Jenna. I can second again.
Thank you both. All right. Anybody opposed? Nobody did oppose, so that motion will pass. Okay, I think we got all of our documents under the way, Trace, and I will turn it back over to you.
Great, thanks, Stephanie. Thanks y'all for that, and Happy New Year. Excited to see you. Appreciate folks joining in. January 3rd came fast. I don't know about y'all, so thanks for being here. We have we're gonna go over a few things, and then we're gonna get into it. We've got a 3-hour meeting today. I'll be curious if we use the full 3 hours, but we certainly welcome it. We're going to be talking, as you know, about all the things that we discussed in our subcommittee meetings. This is a chance to ask questions. This is a chance to push, to pull, to get your thinking out there. We'll be documenting that for purposes of the report around the conversations that happened. We'll also have a survey at the end as well for you to capture thoughts. So if you're not comfortable sharing some of those thoughts here, or something pops up and you're like, oh, I should have said that, there will be opportunity, and that will also be included in the report as well. So just want to be clear on that. I want to bring us back to the roadmap just so we're clear about kind of where we are and where we're headed. Thanks, Jordan, for sharing. So that's us. We're the task force. We'll have 4 topics. So prevention, again, screening tool, hardware, use of restraints, education on the risks of running, and then Intervention Subcommittee, of course, statewide absconder unit, standard response policies and procedures, temporary housing for recovered youth, and education on trauma-informed recovery. Today, we're reviewing the discussions and draft recommendations for screening tool under prevention and statewide absconder unit for intervention. If you want to go to the next slide, Jordan. Just as a reminder of kind of where we're at and how we're doing this. So December 13th, we broke into the groups. Today, we're coming together for full group. We'll review the subcommittee work for recommendations. And I'm going to kind of talk process here in a little bit. So just put a pin in that. And then we'll go back into subcommittees back in February and kind of on and on and on until we get through each of those subject matters and through those recommendations. Any questions regarding the roadmap? Again, this puts us kind of as far as the conversations and then the draft recommendations gets us through July. And then August and September, those final 2 meetings will be finalizing the report, which you'll have a number of. It won't just be in the meeting. You'll also have opportunity to do that asynchronously. Any questions there? Or Doris, anything I'm missing? Okay, cool.
No, ma'am, we're good.
All right, great. So bring it back to the full group. So today we're going to start with intervention for the first half, take a break, and then we'll go into prevention. I want to be clear just on a couple of process things. So one is we're not doing a vote today. This is not a vote consensus driven group, as you know, in kind of our write up on the group and the bylaws. What we are though is capturing the dialogue around these recommendations and ensuring that input, feedback, et cetera, is considered in the drafting of those and then the finalization of the report. You will have an opportunity at the end of each unit or the end of each topic. So today for the absconder unit, you'll have an opportunity at the end, though we're not taking a formal vote fully in support because we are moving these forward. You will have an opportunity to say if you do not support those recommendations moving forward. And for purposes of the report, we will document that. The biggest thing there is that if you are saying that you do not support that as an individual and the entity you represent, we just want to hear the why so that we can document that. So just a heads up there. Any questions on that piece? I just wanted to be clear that folks will have the opportunity to do that if that's where you're at. Okay, great. So again, we'll go, I know that everyone spent their breaks reading these documents we sent out. So we're all prepared. Just kidding. Okay, so we're gonna give y'all time to review these today. I think the assumption moving forward is that since it's not New Year's and the holidays, that you'll do this kind of in between the meetings. But we also know that everybody's rolling in a little tired right now, so we will have some time to review. You received these in your email, but I'm also going to drop these in, and then I'm going to hand things over to Doris to kind of get things going with intervention. So I'm going to drop this link in right now. This goes to the Google Doc, which has the 2 documents. Make sure you were in intervention. And Doris, I don't know if you want me to just go ahead and give them 5 minutes, or if you want to tee anything else up, and then when they come back from the 5 minutes.
Yeah, I just wanted to make one or 2 comments before giving folks some time to read the documents. You'll notice that all of them are 3 pages. I think the goal is to keep them to around 3 pages so that they're not a heavy lift. There are some hyperlinks in there that all of you to documents and content that you've all received previously. So, if you wanted to reference back to those in subsequent meetings, I think that's a good idea. But I think that the piece that we're going to hone in on for our conversation today is in the draft recommendation language. And so pay the most attention to that section. For the intervention part of the discussion today, you'll notice that in the document, it doesn't use the language of absconder unit. It uses specialized investigation staff. So we're trying to pivot a little bit and not let the language of absconder unit be a barrier. So, like just thinking about this in the context of a specialized investigation staff role function unit is the way that this document is framed for today. And then lastly, I said 1 or 2 points, so it's like 5 points. Lastly, you'll also notice that there is some language in there about ensuring that that the recommendations have sufficient funding and resources in order to implement. So we don't want folks to get hung up on the cost necessarily, and really focus in the details of what this particular intervention might look like or might need to look like in Colorado. And I think that is all I wanted to add. So, and that brought us to 20 after. So I think that we'll give you all about 5 minutes or so to read through the specialized investigation staff document, and we'll have some time for discussion afterwards.
Great. Everybody able to access that link in the intervention? Okay. Okay, cool. All right, I'm going to put a timer on. Feel free to go off camera, and we'll see you back in 5.
Thank you both. Okay, good morning, everyone. First, I just want to say thank you and sincerely to everyone on this call, congratulations. It's a big deal to get to this step to where we're doing recommendations. Brian and I had a lot of fun working through all of this, and I wanted to give just a little bit of background on how we prepared the documents that you have before you. So as you all know, Brian and I have been sitting in various subcommittees, kind of bouncing back and forth between each other. And after the last subcommittee meetings, we really spent a lot of time looking at every inch of material that we had produced in those discussions. Your note catchers, we rewatched videos, we looked at recaps, meeting minutes. And that was all really done with the intention of making sure as we work through this and we start to draft language and we start trying to piece together what we thought we heard you hearing and we hit on these points and we could put it all down on paper. And that's why you have 2 very, very robust recommendations, one for each subcommittee. So it was really done with the intention that when we put forth recommendations, they're going to cover all these topic areas. We can certainly flesh them out as you guys work through them today. But as a little bit of insight for when we write the final report, we really envision these recommendations coming after a much more thorough and in-depth discussion of the issues themselves and how they pertain to the directives, how we brought in voices and all of that. So just wanted to piece together those dots a little bit. Brian will be reading the prevention summary sheet. So thank you, Brian. Into Intervention Subcommittee, as Doris noted, we did our best to create a new name, trying to move away from that absconder word and all the connotations that come with that. So we came into the Specialized Investigation Unit. Quickly going over the materials that were provided. While we heard from Texas, we actually did have materials of example units in 3 other states, DC, Tennessee, and Texas. DC, and again, these materials are all available to you here through those hyperlinks. Really, what we liked about the DC model when we were reviewing that is that differentiation that they have on certain responses based on length that the youth or child had been gone from care and certain circumstances. So DC very much kind of mimicked what the group will be heading into next in terms of standardized policies, but then reflected how those can be implemented in a unit such as the one we're discussing. Tennessee, more so than DC, had some correlation with law enforcement, where DC works very closely with social workers in the specialized unit. The unit in DC worked more closely with law enforcement in the area on a regionalized basis. They also have similar tools that we looked at. I know that the screening tool or the checklist tool that was used in Tennessee came up several times. So this came forward in our recommendation in terms of how would we create standard responses? What would those look like in terms of how this unit operates? And then third, we heard from Texas. We actually had individuals from Texas come in and talk about their unit. That recording is available here as well. Texas, more so than the other 2, definitely had more of an emphasis on a law enforcement or formal investigatory model. Many of the investigators brought into this unit are former law enforcement. There was much more of a kind of feel that they brought in law enforcement intentionally so that they had those investigatory skills and they could work with them. However, that unit was still fairly new. And so they were working through a lot of how to kind of shift into trainings and protocols that would reflect the population they were working with. Moving into overview of discussion, largely there was a recognition that a unit like this in Colorado, a dedicated unit for individuals to respond when youth run away from care, would benefit the state. We did acknowledge, and again, we're setting aside even in this discussion today, this notion of resources and funding. You'll see that the recommendation, as Doris says, does acknowledge that. We're speaking kind of in a silo from that today, and we did that as a group as well. The benefits that were thought was this would be a focused and thoughtful unit. Some of the things that we really honed in on as being crucial for a success of this unit would be trauma-informed training for members of the unit, standardized response protocols, and really creating this differentiation, which this large group has talked about in whole, which is creating a unit that can respond faster and doesn't need to meet the threshold that we often hear law enforcement units have to meet. That missing persons, we can move faster. They're trained to deal with this population. They can work quickly within this population. Definitely the group had consensus on needing this to be a multidisciplinary team that is trauma-informed and goes through rigorous training on how to engage with youth and children in this space. Of course, this will correlate when we move on to our next topic about standard statewide procedures, policies, how we'll respond based on, again, circumstance, facility, placement, all of those things. Excuse me, but there was generally a sense that we did not want this unit to feel entirely like law enforcement, that it was important that youth perceive this differently and it didn't have a law enforcement feel. Now, of course, there were some concerns again about funding, and then Sergeant Cotter recognizing what you raised is that, this is potentially something that law enforcement does and could stay with it. So that is something that we noted in our summary as well, that this may be better spent, as Sergeant Cotter said, within law enforcement in that manner. So again, this is a very high overview. You have access to all the recordings and summaries. That's the general discussion that we went through, which led us to the recommendation, which you have before you. As Brian and I were drafting these recommendations, you're going to see that they're both made to the Colorado General Assembly. That's done intentionally so that whatever we put forward will be backed by legislation and adequate funding. Each of these points was really driven to hit those points, which I just mentioned, but also they were also intended to continue the collaboration of a group like this multidisciplinary perspective in implementing a unit as well. So it wasn't just going to be the recommendation moves forward and discussions like these cease. We also intended for this group to be forward and move forward, excuse me, and drafting legislation, regulation, all of those things, so that when we develop the unit, it doesn't fall into a bubble that then is something that has to be rethought and reorganized with stakeholders such as yourself. So I know Doris is going to lead us through each of the points, and I'll stop talking in a second. But I just wanted to point out a couple things we left open. Obviously, you can see there's places where it's potential to fill in agencies. We left some statutory sites a little open-ended. We know that there's no 26XXXX. We just want to recognize, kind of Ashley's laughing, where we wanted to live. This is really for you guys to discuss and have conversations about. So Brian, I'm going to see, is there anything I've missed here, or Beth? And Beth, thank you for working with Brian and I to kind of get this across the finish line and finalized. I really appreciate your time during that holiday week. Brian, Beth, have I forgotten anything? All right, I love a thumbs up. And Doris, I'm going to stop talking and hand it back to you.
Awesome, thank you. So I'm not going to read through each of the dot points. We allocated that time for all of you to do so. So I really want us to move forward into the discussion portion to talk about these finer points, what questions you have that may not be, that you just want to clarify what is meant by one of the bullets, what concerns you have, what things you really like, so that we can capture that in the notes. And again, to Trace's earlier point, following today's meeting, we will send out a survey that allows you to add some additional commentary to reflect, again, questions, concerns, et cetera, so that we can reflect that in the report and make sure that your voices are incorporated. So I'd love to open up the floor. First with this, Brandon, I see you raise your hand. In a hurry, I love that. But want to see if there are any points of clarification that folks have before we dive into more the substantive portion and the things that you like and or would like to see refined. Brandon?
Yeah, hi, thanks. I just have a quick question. So you mentioned that there was a point to make it that it's not feels like law enforcement. What's the motive behind making like a point that it shouldn't feel like a law enforcement unit? I'm not understanding that, like what the logic is behind that, I guess, at this moment.
Sure. I can respond based on the discussion that we had in our subcommittee conversation. There was I think two things. One, there was a recognition for the particular skill set that law enforcement has that could be beneficial in this work, but there was also a concern around the way in which law enforcement is oriented and the way that experience would be felt by a child or youth who has run away from care. And so, wanting to ensure that there is an approach that is trauma-informed, that recognizes the specific and unique needs of young people, and not wanting it to feel like they were in trouble, which is a concern that was raised about kind of the orientation of law enforcement versus potentially another group that's multidisciplinary. I want to, Jordan, I see you come off mute if there's anything that you want to clarify, but also for the subcommittee members, if there's anything that you wanted to add or amend to how I read the discussion. Jordan?
Sure, yeah. The one other thing that I think came up a couple of times was an acknowledgement that members of this unit may have repeat contact with youth and children who run away. And so removing that feel that this was law enforcement and the child or youth was in trouble was important to kind of build that trust and relationship. That is something that Texas works on very hard, is to kind of build a rapport with youth so that when and if they do go missing, that individual who's assigned from that unit can kind of be yet another resource. And in some cases in Texas, youth who run actually call that investigator first, not their caseworker, not their parents, but they recognize it. So that relationship, and so that was one of the other points as well.
I guess, I guess my only like concern would be that, you know, when you're talking about runaway kids and in situations that it could get, you know, pretty, the environmental factors, the and circumstances are as concerning as obviously the feelings of the kid. I think it can get pretty dangerous, and you know, and I would be afraid to lose that, you know, presence of security that individuals that are trained like law enforcement provide. I agree with all the statements that it would, some of the additional training would need to be, you know, different, and, you know, approach is different. But I also feel like, you know, good law enforcement can be trained that way. But I would be hesitant to, you know, I think there's advantages of having that, you know, level of reputation in, you know, from a community context and a respect context and just a safety context. You know, so that'd be my only concern with that.
Thank you for that, Brandon. Stephanie, I see you came off mute, and then we also have a comment in the chat from Janelle, a concern around basically reinforcing the idea that law enforcement is bad or should be scared of. And so I think to your point, Brandon, you know, ensuring that there is proper training for law enforcement could be beneficial. Stephanie?
Yeah, just a couple things. I think one is, at least in my mind, is scalability, right? You know, when you involve just strictly law enforcement, and I say that very deliberately, right? If this was just a law enforcement effort, trying to duplicate protocols and or training across every single law enforcement agency across the state is a lot harder than if you had a regionalized unit with fewer people. So I just mentioned that, depending on what the vision is. And then I also just read the recommendation as being pretty interdisciplinary, that it wouldn't just be law enforcement any more than it would just be human service related or facility related. So unless I have that wrong, my feeling was that the notion was to have a group of professionals, right, who all would have a part of this process, be part of this unit. But I just want to clarify if I read that correctly.
Yeah, there was, and again, subcommittee members chime in if I misstate anything. But there was broad agreement for there to be a multidisciplinary approach. I don't think there was any disagreement in terms of, you know, kind of having a team of folks who represented different roles in relationship to kids and youth. I think the question then becomes who gets deployed for that initial investigatory response to find the missing child, that I don't think that there was consensus on. And so I think that you know, kind of having some conversation around who is that team of folks who would respond to find the child or youth is, I think, an important point for this conversation. And you know, you know, could it be law enforcement? I think potentially. I think that there was some conversation about maybe not having a cookie cutter approach across the state, but having some potential options where the lead entity that goes out and finds the child could vary based on resources and, you know, kind of size of the jurisdiction and so forth. Brian?
Yeah, I think so. As I'm looking through the recommendation, I feel like we missed a couple key points. One, we talked about a timely response, and I don't know that the recommendation really addresses that clearly. That we're looking for, at least from my recollection of our conversation, we're looking for like a 24-hour-a-day response. So that means whatever unit we are trying to advocate for, we want them to be staffed 24 hours a day so that they can respond in a timely manner. And we talked about how that's really tough to accomplish. But if we're going to step away from law enforcement being the primary response, then I think we need to make sure we're clear that we're expecting a fairly well-staffed event here. I am a little bit concerned because we make this explicit statement in there about no use of force. I certainly am not advocating that in every instance that we find a runaway, we should be using force. But I think we would be foolish to believe that in every instance, we're going to find that kids don't then run. or that some level of custody isn't necessary. If we're not authorizing arrest, restraint, or physical force for a youth to return, then we need to be clear about what is it that they are allowed to do. In state statute, we do allow officers to have temporary custody of kids, and that's an explicit statement that the legislature's made. I think we need to be clear in our recommendation about the level of force or the level of restraint that we would allow a unit like this to be able to use. And then we need to define then how law enforcement responds. Does this affect law enforcement's ability to use reasonable force or restraint? If the kid runs from this unit, can a law enforcement officer then take custody of the kid in the traditional fashion, or are we trying to step completely away from that? And so I think we need to be a little more clear about that. I am going to take a second and advocate for law enforcement being a major part of the response, not excluded from it, not just like, well, we have this team and they talk to law enforcement, but being part of it. And I would support a multidisciplinary team response, because I do believe we've seen that successful in other areas. Specifically, in my experience, federal task forces do that all the time to bring intra-jurisdictional issues to light and can be addressed quickly. But law enforcement has a lot of tools that are already built into statute. And from a pragmatic point of view, we shouldn't try to recreate the wheel. Law enforcement can write search warrants. We can do active geolocates on phones. We should just piggyback on that stuff that already exists. It's not purely a financial piece, but when you add that plus the staffing plus the dispatch centers, you add all that together. I just, again, I'm going to say, I feel like centering this in or attaching it in some way to the law enforcement response is appropriate. And just to further that point, our mental health crisis, our STAR teams that are so effective in the communities, they're based out of law enforcement response centers. That works because we have this infrastructure that our society has built on for centuries, and we shouldn't just walk away from it. I am very, very curious. We did get to listen to Texas talk about their program. That presenter was very supportive of what they were doing, but I'm really curious about what Tennessee and DC did and how they chose to center it or not center it around law enforcement. And then, like, who's the most effective? Like, and I don't know if there's an outcome to that, a measurement to show DC does better than Tennessee, does better than Texas, but some metrics around, like, what, not just is it a cool idea, but does it demonstrate effectiveness? Is there anything that we can do with that? I'm also going to jump in and talk about relationships. I know that when my human service peers call other human services agencies, they get a better response. And I will tell you that when I call law enforcement, I get a better response. I can have cops at a house in moments, whereas if my human services peers call for a law enforcement response, there can be a very long delay. And often I make myself available to my human services partners so they can call me so that I can leverage my connection with law enforcement to intervene in a situation that warrants that intervention. When outside agencies call, we often have like standardized response protocols that give us a certain response time frame. And by leveraging these partnerships, we're able to get a more timely response. I've had to call human services and, compel or convince my peers that a more timely human services response matters. So again, if we're just creating a unit off to the side, then we're ignoring these opportunities for existing partnerships to take hold.
Awesome. Thank you, Brian. And we saw in the chat that there's some agreement about a model similar to the STAR approach as well. David?
Hey, good morning. First of all, reading through these recommendations, I really like them. When I look at it from a 30,000 foot level, I go, wow, this could be very costly. And why I say that is I'm sitting over here on the western side of the state, and I always think about how do we implement these types of things in some of our more rural communities. And I guess in my mind, I'm going, all right, so this is kind of a state entity through CDHS that could probably have some people that are working, trying to collaborate and build teams throughout the state. And how could some of the funding be toward our local municipalities to train law enforcement groups to have people on these MDTs throughout the state. I mean, I'm thinking, you talk about sheriff's offices through the counties, police departments, marshal's offices, and things like that in some of these smaller areas. I'm just like, how do you, I guess that's kind of my first question. How do we encompass this throughout the whole state of Colorado in some of our smaller, more rural areas, instead of just our larger municipalities like the Denver metro area, Colorado Springs, those types of areas? I just think we have to make sure we're thinking whole state of Colorado and implementation and the cost of that, and how do we do that with training and getting this throughout the whole state, just not the Front Range.
Doris, can I jump in?
Thank you, Trace.
Sorry. Yeah, David, I don't disagree with you. I think for the purposes of these recommendations, though, I do want to pull us to the conceptualized piece and not the implementation piece to get through these particular recommendations. But I think that is something to put a pin in, certainly for the report, Jordan. So I'm like looking at you thinking of like, right, there needs to be a whole piece around what it would take to do the work for the implementation piece and the considerations there. But I think that these recommendations, we need to stay kind of more in the conceptualization space. So just want to kind of differentiate between the two. Doris, I don't know that you're going to love this recommendation, but I am wondering if, I know it's going to be tedious, but I do think, because we're kind of theorizing right now on some things, I do wonder if we actually get a little tedious here and go recommendation by recommendation, just to ensure that we're not missing any, because I think it's clearly there are topics and recommendations that we are more drawn towards, but there are so many details here that I don't want us to lose them. So we're going to have to keep it tight on time, and I can kind of help if we kind of get off on one, but I'm just wondering if you want to go by each one and just make sure that there's no, that we're not missing anything, that maybe we're not misstating, or if the language isn't confusing to folks, and then just move through the recommendations that way. Is that, I know it's super tedious, but I just want to, is that okay?
Yeah, I think that's fine. I think we will have to be really tight on time. I may not get to all of them. But I think that makes sense. And then again, we'll have another opportunity in the survey to come back to these to ensure that folks have an opportunity to give input. So I think to that point, it sounds like there's been a lot of conversation about the who, in terms of who is the responsible party, which kind of gets us to that first point. In here, the recommendations have the lead agency being the Colorado Department of Human Services, and that there is language about ensuring that there is this multidisciplinary approach to including diverse voices and stakeholders in developing the applicable regulations. So I think we heard an alternative approach, and that is having this function housed within law enforcement, but want to open up the floor to kind of have some more detailed, specific conversation around this particular dot point item in terms of who then is the lead agency in housing the unit. Brian?
So I wouldn't mind throwing out, I like the idea of the regions. I think that's good, effective use of the resources, considering how diverse our state is in population. So I like the idea of regions. I think the State Department of Human Services is a great starting spot to be expected to create like a multidisciplinary team, but it shouldn't be I don't believe it should be a unit under CDHS. I would advocate that we should have this MDT where CDHS organizes it, and then there's an expectation, a legislative expectation of participation, supported with funding, of course. And that support should come from the variety of mental health and support human services professionals that exist in the counties that are within that region, as well as law enforcement agencies, and be very clear about that law enforcement agencies, whether they be sheriff's officers or police departments, that they are expected to provide staffing to support this. But overall, it would be organized and managed by the State Department of Human Services.
Thank you, Brandon.
I guess, you know, my first instinct around this would be that, just as an alternative for practicality, you know, that you do, you know, similar to like SROs, you know, for schools, that it's more based on, because we're talking about out-of-home placements, you know, whether it's regionally based out-of-home placements or even individually based out-of-home placements, that you would pursue like through, you know, very similar to that, hires for based on, you know, out-of-home placements, and then it's oversight and managed by oversight and training and all that stuff from the state and DHS and some of that communication logistics. But I think from a practicality standpoint, that you build it up through, you know, funding through, you know, out-of-home placements, they're able to, you know, go into partnerships and have like an SRO system at each area or even each out-of-home placement, if that makes sense.
In that approach, would there be like a state lead agency?
Well, I think from like an oversight standpoint and setting guidance and expectations, I think it makes sense that DHS is the oversight, and but I think it's managed locally based on within rules and regulations and whatever is put out. You know.
Okay, so in terms
partnerships.
of the, sorry, Brandon, in terms of the finer point in implementation, then is what you're talking about, and you know, kind of what the expectations are and who does what in fleshing out the details, then that's where you're talking about, like there might be a, you know, the agency responsibilities and so forth.
Yeah, like so, like at Southern Peaks, we work with, you know, Canyon City law enforcement and partnerships around this very similarly, though not to this extent, like going out and you know, searching in you know, large amounts of areas, and I think it would expand on it. But you work with your law enforcement, and individuals are based out of, you know, assigned to Southern Peaks, and if we have a runner, you know, they're there to help, you know, support directly to that, and you know, you coordinate through like trainings and different things that you're trying to you know, accomplish, you know, to help law enforcement, you know, manage our certain types of kids, and vice versa, us to improve on, you know, certain things. And so, you know, I would base it, you know, from a practicality standpoint from that way, because you're really looking at then funding either law enforcement or organizations to be able to provide this, you know, across the state, and then it's managed and the guidelines are and oversight is provided by CDHS.
Okay,
thank
you. So I think on this first point around, you know, kind of who would be the lead entity, you are comfortable with CDHS being that lead agency?
Yeah.
Okay.
I mean, I think that's their purpose, in my opinion.
Yeah. Does anyone have any concerns with, who hasn't already voiced kind of the nuance of their opinion with the legislation, you know, sort of creating this unit, the responsibility for this unit under CDHS?
If I could just jump in, Dennis, I'd love to hear from you, not to put you on the spot, but I will. I just, because you obviously are a representative from that agency, I would love your response. Just what are your thoughts? Because I think that's important to have your view.
Well, the way the recommendations are written, particularly the parts about trails, would indicate that, like, to get to where you need to be, it would probably be then housed in CDHS, because you need so much access and training in trails to really be able to do this successfully. I'm not sure law enforcement can do that in that way. So it will take us a while to get to there to that place in trails too, to build that component into trails. So but I think like the way the recommendations are written, it seems to me more sense that it would go to CDHS possibly because of the access to trails. Because you would need to have to have really good trail skills to do the investigation that you would need to do, right?
Yeah.
That would mean you would have to have access to everything in trails, the highest level of access to trails. So I just don't see that being a law enforcement entity.
Thank you, Dennis. And Doris, I would just add, I think jurisdictionally, the very the children that we're speaking of are under CDHS purview. I mean, that's the reality, right? They're not under another state department or entity. So I feel very comfortable with that first recommendation for the reasons Dennis enumerated, as well as the fact that, I mean, these are their kids, so to speak. So.
Thank you. Thank you for that, Stephanie. Brandon, I can't tell if you had put your hand down and you put it back up or if it's just still up.
Oh, no, it's just accidentally still up. Sorry.
Okay, thank you. No worries. I was just making sure. I lost track of it and then I wasn't sure if you put it back up. All right, so it sounds like for the most part we have pretty good agreement on this first bullet. Brian, I see your note in the chat about local mental health centers being a part of the MDTs. I think adding that potentially, I know that came up in the conversation in the subcommittee, having someone who has a mental health background involved. And so maybe that's, where we have this placeholder XYZ, having MDTs added to that. That's what we should advocate for is more than trails. Yeah, I think there's an opportunity to flesh out what other systems might be needed in order to support this particular work. Dennis, I see your hand up.
I just want to be clear, like if I have other reservations, but on this idea of where it would fit, I think it would be CDHS, but we'll get to other concerns later.
Perfect.
Right?
Yeah,
Okay.
yes, we're gonna walk through these. So yes. All right, so then I think we'll move on to the next step point, the development and implementation of protocols for the unit that incorporate prevention efforts to reduce the likelihood of subsequent attempts to run away. So we will have more conversation about prevention in a moment, but this is one of the areas I think where our subcommittee conversation bleeds over into the prevention subcommittee in ensuring that whatever intervention is used or response that's used for kids who run away, that part of that intervention includes reducing the likelihood that they will be a repeat runaway. And so having some protocols in place that get at the underlying needs of the youth, what prompted them to run away, and other mechanisms to reduce the likelihood that they'll run away again. So I want to open up the floor for any clarifying questions or any concerns, and then we'll, if hearing none or after we resolve that, we'll move on to the next point. This one seemed fairly straightforward.
Hey, Doris. I'm sorry, I
Yes.
can't raise my hand. My little hand is not working for some reason. I just want to say that this is already in state and federal law. What this recommendation would be doing is just requiring us to do this in a way that is consistent, both in terms of a statewide approach as well as with each individual youth. So I just wanted to point that out.
Thank you for that, Stephanie. I think based on the conversation, and again, subcommittee members speak up, this is one of the places where there was a fair amount of conversation around trauma-informed. And so whether or not it makes sense to add trauma-informed right before prevention, I don't know. It seems like it might, but would, if there's any, kind of strong hesitancy or pushback from the subcommittee or others on that point. So then the way that I'm thinking that incorporate trauma-informed prevention efforts to reduce the likelihood of subsequent attempts to run away would be the addition that I would recommend, just based on the, and I know I'm not a task force member, but based on the conversation that we had in our subcommittee member meeting, it seems like that would be a desire of the group that's not captured here. Beth, I saw you nodding.
Yes, I think that's a
Thank you
great
for
idea.
affirming me.
Yeah.
All right, moving on to the next dot point, clear delineation of the unit's scope and authority, which is not to exceed locating youth in specific circumstances and does not extend to any authority to arrest, restrain, or physically force a youth to return. So Brian brought up some questions, concerns about this one specifically around, restrictions on restraining or physical force for youth. So I imagine there's an opportunity to have some conversation around here. In addition, I know we have we'll have the notes, Brian, from what you shared earlier, but any other questions, concerns that folks have? Elizabeth?
Yeah, I think that the units have to have the authority to, I mean, you've got the whatever mental health worker, social worker, whatever, who's trying to engage the child and make sure that they come willingly. But in the long run, I think the unit has to have the authority to bring the youth back. I mean, otherwise defeats the purpose, right?
Thank you. And I just want to raise that this, this dot point doesn't, I think it couples with the training and, sort of skill development, the multidisciplinary approach. So it's not, it is a specific line item, but taken together, there's still there's also the requirements around training and the like. Ashley?
Just thinking about this part, I can see how it's difficult if you can't bring the child back. Like, what's the point? Although I think knowing where the child is and who they're interacting with and what's going on does help you get them back in the fold. I think my concern from a youth perspective about allowing sort of a pseudo arrest is that I think you're opening up a child or youth to incur charges. Like if they resist and they assault somebody and I think there's a lot of problems that could result from treating it like that. I also worry about that key piece of having, I don't think a youth is going to call the investigator like we heard about from the other state if they become sort of this unit that is just kind of pseudo arresting youth. So I think there's a line there, and I'd love, I wasn't part of all of the meetings about what the other states did, but it would be nice to know how they handled that, because I do think that would be a concern for me and how this would be effective.
Thank you, Ashley. Brian?
I think Ashley makes some good comments around, charges related to youth, but I also think that between legislature and education, because this is really a community issue, that we can work with our prosecutors' offices on how to manage those situations. And I think generally our prosecutors do a good job of not prosecuting in the interest of justice. We certainly can't have an exception carved out for every single rule that exists. But I think that's something that could be managed, even though we're trying to avoid any force or any physical need for physical management of kids. I think that we do have to make sure we provide for it in some fashion.
Thank you. Yeah, I think for me, and again, I know that I'm not a member of the task force, but for me, one of the things that jumped out is disparate treatment for youth of color. We know that with touches with many systems that youth of color are more likely to be harmed. And so, when I think about the potential for, using physical force, that there is a likelihood that more force will be exercised for youth of color. Just wanting to name that was one of the things that jumped out for me with this one. All right, so moving on to Ash. Oh, I'm sorry, Stephanie, go ahead.
Yeah, I was just going to ask Beth if you could jump in on that. I know that you're running a unit and would love to know what your approach has been. And I know you work closely with Sergeant Cotter too, so just curious.
Yeah, I mean, I can speak to, I mean, we do have youth who call us when they're missing, and then it's like, okay, I'm in a bad situation or I need some basic needs. But we also have a confidentiality policy too that prevents us from, we're not going to contact law enforcement if they're missing or if they have a warrant, because otherwise that will break down that trust. And my concern in regards to going physical is that you're going to have people who respond. And I know we've talked about a lot this morning about the importance of training, but people are understaffed. You have calls holding, and my concern is that people are going to immediately go hands-on. And some of these situations, you have to, in my experience, play the long game. And I mean, you might be out there for a couple hours talking down and de-escalating the situation. But I think that that's extremely important, knowing that these youth have gone through trauma, and this unit can't cause additional trauma. And I think if we jump to immediately going physical or hands-on, that's not going to make this unit successful.
Thanks, Beth. If I know we'll move on to the next point, but I guess I would ask that whatever, right, as we massage these recommendations, that we put some sort of caveat there, because as it is right now, it says the unit does not extend any authority. I think that's just a point we either need to come back to, or we need to put in the unit, or the discussion shall consider, right, the type or use of force that may be employed under these certain circumstances. Just something that holds that thought for this group.
Thank you for that, Stephanie. The next stop point is a consideration of how this unit may adopt similar tactics currently utilized in crisis response units. I think we've sort of had a thread of that conversation in, sort of the conversation around a multidisciplinary approach, modeling it on the STAR approach. So it sounds like we've captured that, and there is some agreement on this particular item, but want to open the floor for any questions or concerns. Awesome, hearing none. This next dot point is that all employees within the unit must be trained in trauma-informed practices and receive standardized mandatory training. Another point that we've touched on more tangentially in our conversation today, but there was a lot of conversation in our subcommittee about, doesn't seem like it's a controversial one, but again, opening the floor for any questions or concerns. Awesome, we're rolling through them now. Ensure that the unit works collaboratively with all licensed out-of-home placements through standardized response protocols. Brandon, I think this was related to your comment, but again, want to open the floor for any questions or concerns. Awesome, nice to see you come off camera, Brandon. Probably because you heard me say your name. The development and implementation of protocol. Oh, sorry.
I
didn't see your hand. I'm sorry.
So I just want to reiterate that in my view, the best plan here is the MDT. And I do think that when we get to this point, we're talking about licensed out-of-home placements, and the best relationship with that is going to be the County Department of Human Services. So I believe that if we have this response area and that has a team and a multidisciplinary team, part of that multidisciplinary team, that MDT, is going to be the counties, the various human services counties that have the licensing responsibilities and relationships for these out-of-home placement facilities. And so we create that partnership there. And so I think that could be something that's delegated to them to say, hey, make sure your placement facilities have these pieces in play. And so that doesn't fall to law enforcement. It doesn't really fall to the state. It falls to the state to help make sure that the county has these plans in place.
So that sounds like in addition to what is here currently, that there is maybe an additional recommendation around the unit working through or collaboratively with the local human services, county human services agencies, and licensed out-of-home placements and their respective licensed out-of-home placements or something to the like. Is that what you were getting at, Brian?
Yeah, I think the county already goes in and works with them on a bunch of stuff, like tons of stuff, from facility management to, physical restraint of children, like all sorts of stuff. Why would we recommend that some other agency, some other unit from the state come in on this one little piece, this one little response piece? Why wouldn't it be part of the county's work and partnership with the placement facility already to make sure that they have good plans that are in line with the county's MDT partnership that's going to play? And that way, again, they just have to maintain that one solid relationship that's all encompassing.
Thank you. Dennis and then Brandon.
I think the counties do have a role here, but just to clarify, CDHS oversees the licensed facilities. So I think that component is already built in. If this were to pass, we would have to write rule around it, and we would have to have the providers create their plans. We would have to approve those plans. But I don't want to lose the component of county cooperation. I think it needs to be added. Thank you.
And then, so there's a part of it that is maybe part of this recommendation that includes county cooperation, and maybe that's, who's named as part of developing this overall response, and also part of the conversation on implementation that will come later. Brandon?
Yeah, I was just going to echo, kind of what Dennis said, that I think from, definitely counties have a part in this, but I think from a consistency standpoint, you don't want to get into a scenario where each county is kind of training and doing things differently than one another. So I think you still want a central approach from, at least from, expectations, rules, oversight, and enforcement. And that's why I would more advocate what Dennis would be saying, is like the state monitors the organizations or something like that would be the ones driving a lot of this.
Thank you. All right, moving on to the next stop point, also tracking time. I think we're about 15 minutes left on this conversation before we're scheduled for a break. So going into the next point, the development and implementation of protocols and mechanisms to ensure the unit will access and share pertinent data that may aid in the recovery of youth and prevent future runs. Such data may include health records, past run history, and relevant information, family contact, and applicable child welfare history. This may include access to various law enforcement databases, as well as social media accounts and contact information for the youth. I think this goes to your earlier point, Dennis, in referencing, without saying it, the data that's housed in trails, but also some additional data that may not currently be housed in that system. Anything that folks have questions about or concerns? Brian?
I just think this recommendation is exceptionally broad. It touches on a ton of things. We can't grant access to this unit access to social media records. They're allowed to search publicly available things, but we can't just grant them access to all of the Facebook. And whose Facebook account would they be accessing? People who may be harboring the child, or the child's, or someone else's. So I just think that that's exceptionally broad. And then I think we also start to touch in, just like if I were to start to recommend access for law enforcement trails, I could see a lot of hairs getting triggered up. And that's kind of what's happening here, is we're giving this broad access to any law enforcement record. So I think we need to hone that down to be a little more specific to what we're actually granting access to. With that said, I do think by housing this in CDHS, that we're able to recommend access to many of the records that CDHS already has access to, including the benefit systems, which I found to be a useful law enforcement tool when we're looking for certain situations, but also all of this, many of the things that are within trails, explicitly opening up maybe restricted records to this unit so that they have access to it. So
Thank you. Beth?
I think again, it's that multidisciplinary approach, and that there's an MOU of information sharing, not necessarily giving full rights to access those databases, but knowing that key information should be shared so that we're staying within that trauma-informed approach when we're engaging these youth.
Awesome. Thank you, Beth, which actually moves us on to the next dot point, which is specifically around information sharing. So the creation of a standardized information sharing requirements with law enforcement departments of human services and other partners. So having a formal mechanism to create data sharing agreements across partners to enable access to for this unit to have more comprehensive data and information. Any questions or concerns about that dot point? All right, and then specifically related to trails, the development of a system in trails to ensure that records related to the absconder unit, and we'll have to update the language on here, are consistently accessible throughout the state. Any questions or concerns? Dennis, anything from your end, being a resident expert in trails? All right, I saw you shake your head. I thought I heard somebody speak. Okay, no. The incorporation of multidisciplinary teams into unit responses and practices. We've talked a lot about that, so I don't think that there's any disagreement. So I'm going to move on to the next one. The development of an information system for the specialized investigation staff, which is conducive to information sharing across multidisciplinary teams. I'm not sure how that one is, and I don't know if others have this question, but how this particular dot point differs from the creation of the standardized information sharing requirements. Is this like a database that's specific to that unit?
Yes, when we were drafting this, it was basically a database that the unit would put its information into if it.
Okay. Okay, thank you. Any questions or concerns about that item? All right, we've talked about this both in our subcommittee and a little bit today, going into some of the standardized protocols. But the creation of a standard response times and mandated memoranda of understanding with facilities. So again, the details would be sorted out later, but this idea of having a standard response times and mandated memoranda of understanding with facilities. Any questions or concerns about that item? All right, the proper prioritization of requests for absconder unit involvement and requirements for communicating when the unit is responding. So if there is a statewide unit, then having a mechanism for flagging them when a youth goes missing, and having requirements for getting updates when the unit actually responds to find a youth, when they've located a youth, and so forth. Any questions or concern about that item? Stephanie?
Yeah,
Using your manual hand?
My manual hand, I'm old school. Yeah, I just wanted to clarify that because when I read the proper prioritization of requests, it brings me back to, and I can't remember what states we looked at, where they've created various categories, if you will. Is that what we're referring to here? Like, for example, children with intellectual disabilities, for example, would be undergoing a 6-hour response, and children under 12 would be a 12-hour response. Is that what we're referring to?
Yeah, this is kind of foreshadowing the next topic the intervention subcommittee will move to, which is that statewide standard protocol. We're just trying to kind of work those in as we go.
Got it. Thank you.
Yeah, and I think Stephanie taking the last two bullets sort of together, like sort of having the conversation around, what are the considerations for like a higher priority youth? I mean, you don't want to say that any of them are low priority, because that's the role of this group, is to ensure that all youth get due attention. And then how once the unit is notified, ensuring that they then deploy that prioritization process in searching for the youth, and then also providing updates and communicating. Awesome, thank you. The next dot point is the consideration of a regionalized model for the unit to adequately address the unique needs and circumstances of urban and rural areas. This conversation came up. I know Brian put a note in the chat that we would talk about that here later, that there was an item that specifically gave consideration to the differing needs of different communities across the state. So this bullet point was an attempt to recognize that that there are unique situations across the state, and trying to ensure that there's an account for that. Any questions or concerns? All right, seeing no raised hands, manual or otherwise, we're going to move on to the next one. The consideration of whether to adopt and require the use of standardized trauma-informed information gathering forms and protocols similar to those used in Tennessee. So a nod to one of the specific states that we looked at. Any questions or concerns about this item? All right, we're almost done. The consideration of whether this unit could also be the location of other related entities or programs recommended by the Timothy Montoya Task Force. Jordan or Brian, can you speak a little bit to this dot point? I'm not sure I understand what it's saying. Oh, and then Brian, I see you have your hand up, and then you put it down really, really quickly.
Yeah, so this is just kind of an acknowledgement that if we build this unit in CDHS, and as we build other recommendations to address other directives, this could be a landing spot for those programs. So a lot of the other issues that we're going to be moving into in our subcommittees have to do with standardized statewide policies and finding a place for those to be housed, lived, and existing. So this could potentially act as that hub for other programs or recommendations that come out of this task force.
The unit would serve as that hub?
It could potentially, if it needed to, yeah.
Okay, I probably changed the word location to something else.
Okay.
Brian, I see your hand is up.
Yeah, I kind of want to echo on what I think Jordan is saying, that this, again, I think an MDT is the best approach. Management of it would be with CDHS. CDHS could have their sort of management of these MDTs, have the responsibility to implement or oversee some of the other ideas, specifically in the prevention task force, which I haven't participated in, but I'm confident they're going to have some phenomenal ideas that could be managed in this same place. And so I think that I would kind of like to recommend that whatever recommendation we throw out towards the state not be divided between intervention and prevention, but be one recommendation that includes all of this. And if we end up recommending a specific unit or a specific piece of CDHS, that it'd be more all-encompassing.
Thank you, Brian. Any other questions or any concerns about this bullet point? All right, we go on. This last one is the development of procedures to follow if it is discovered that a recovered youth has been victimized in some way. This should include a practice that provides the youth with a clear understanding of next steps, their rights, and how their preferences will be incorporated. So more specificity around response, specifically in the event that the youth has been victimized while in runaway status. Any questions or concerns about this item?
I think the only thing I
Stephanie?
would, Yeah, the only thing I would just say is in terms of a recommendation, I just want it to be noted that this again is an expansion of state law and regulation already. It's just a matter of doing what we're doing better versus doing it for the first time.
Yep. Thank you, Stephanie. Dennis, were you going to say the same thing?
Pretty much the same thing.
Awesome. Thank you. Any other questions, concerns, comments for this bullet item? Hearing none, we got through with time to spare. Whoop, whoop. Good job.
Tough crowd out there, Doris. I didn't see any confetti flying, but I do want to make sure we move into any sort of outward dissent that folks want to share as far as these recommendations overall for purposes of the report. Obviously, we hear the feedback directly. I want to also just say I've just been creating this survey kind of in response to how this conversation is going. So I broke the survey into the individual recommendations that you can give the individual feedback to. So just FYI, you're not giving a general feedback. We'll be seeing kind of like any individual concerns on those recommendations. So Doris, that's the only thing I think, just making sure we have space for that before we break.
Awesome. Thank you. Brandon, I see your hand up.
Yeah, I just want to make sure, like, that, I guess, to be on the record, that I agree with Officer Cotter. You know, I don't think we should overlook the tools or the means of using force. And I think that needs to be discussed way more thoroughly in this. I think the reality is, you know, nobody wants to use force or, go hands-on in situations. However, when the situation is worse for that kid and is dangerous for that kid, which there are going to be many of these situations where they are, that not providing the individuals the opportunity to protect those kids in a way that is urgent, I think would be problematic, and I think would ultimately continue the issues that runaways are having out there, like trafficking and things of that nature.
Thank you, Brandon. Awesome. Thank you for your note, Stephanie, asking this question around whether there's going to be more opportunity to discuss the use of force. I think this question was to Jordan and Brian.
Yeah, I think the plan right now, so because we have to keep moving, so we will not see this recommendation again until we come back as a large group in July. But Brian and I will work to adjust the language in a manner that you've described, Stephanie. So if there's places where we need additional detail, we'll give additional detail. If we need to broaden it into additional consideration, we'll move through there. But in terms of just be very clear, once we put this down in 3 minutes, this group will not see this again until July. So we're kind of working our best to get that incorporated in there.
Jordan, well, they will have the opportunity with the survey. So that will be their last opportunity. So we'll have this conversation today. We'll follow with the survey, respond to the survey to make sure that any additional input that you have gets duly reflected in the report.
Right. And I would just add, that's fine. I appreciate that. And I guess for the comfort of the members who have various or differing opinions, and Jordan, I think we already know, I think I know the answer, but I just want to confirm that all these members' opinions will be represented in its final report, including those who feel a certain more of a use of force support versus those who do not, and that ultimately this entire issue, the entire Timothy Montoya Task Force recommendations would be moving on to probably subsequent committees after that would work on these operational details. Am I correct in stating all that? Because I don't want anyone to feel here like, oh, we got shut down, the timer's off, right? We'll never see it again. So I just wanted to emphasize that and have you confirm that my understanding is right.
It will. And that's why we're asking and creating the space right now for dissent. So if you recall how we formed the interim report, right? That was very high level, right? We looked at summaries, but because of the nature of the recommendation, because of the entities we represent, when we note that dissent, when we note those concerns, it will be attributed to individual members so that the record is extremely clear. That will be a very big distinction between interim report and final report. So the outline of the discussion leading up to the recommendation will be in depth. It'll include all these concerns. And that's why I think we just wanted to give this space for dissent here. And I also just want to broaden the question to, just to be very, very clear, separate from specific details of the recommendation, I just want to ask the group, if members here present today, if anyone in whole does not agree with moving forward with a recommendation for a specialized investigator unit in whole, appreciating that there's several nuanced details, I just need to know in whole if there is disagreement with that. Doris and Dennis, I'll hand it back to both of you.
Yeah, thank you. Dennis, are you raising your hand to say you disagree, or did you have a question or comment?
I don't know that I'm not in a position where I feel like I disagree. It's just really hard to consider this recommendation moving forward by itself because of it will be very, very, very expensive. So it seems to me like we have to, at some point, the Timothy Montoya Task Force needs to look at all of its recommendations together, figure out what the cost of these are going to be, and then try to prioritize what we want to have moving forward. That's my concern.
And we will, Dennis. So one of the directives for this group is consideration of necessary resources and allocation for everything that we're putting forward. So there will be a specific place for us to come together. That'll be in July, where we look at all of these in whole and we really put down, like, we appreciate funding. Here's where the funding barriers will be. Here are suggestions for that. And that's why we keep separating them out, because applicable resources, needed time, needing staffing, all these things that I know we're thinking about because we think broadly and we look at systems broadly, there is space for that. So I want everyone to rest assured, we are coming back to that. We're not ignoring it. We're not delusional that by recommending the legislature give us money that we think it's actually going to happen. We know that, but we're just creating a very distinct space for it.
Okay,
Thank
well,
you,
with that, then I don't have any concerns.
Awesome. Thank you, Dennis. Brian? Oh, you're muted. You're muted, Brian. Brian, you're muted.
Thanks. I do have concerns. Money is a part of it, but really I think that the multidisciplinary team model is a better model. It brings, like Brett has mentioned, it brings these specialized resources these specialized skills into one place. While I think that CDHS is the best agency to organize it, they may call it a unit, but really the actual boots on the ground, the people that are doing the searching for these kids, that should be a multidisciplinary team, not a team of employees that belong to CDHS.
And Sergeant Cotter, I just want to make sure I'm clarifying that point, because the recommendation does include the multidisciplinary component pretty heavily. So are you objecting to the recommendation for any unit distinct, or because the recommendation includes multidisciplinary? I just need to make sure I'm very clear on what you're saying. No,
I think it's a good question, Jordan. I think when I read what's recommended right now in this draft, it is confusing. It talks about a unit, which what I hear when I hear unit is a group of people they belong to an organization and they work on a specific task. And what I'm recommending is a multidisciplinary team, a team of independent professionals that come together for a task. And so the CDHS should, of course, have in my recommendation, some group that manages all of these regional MDTs, but the people that are actually conducting the investigations, the searches for these kids, they should be funded and salaried or assigned and hired by their respective organizations, whether that be mental health organizations, County Department of Human Services, law enforcement, county law enforcement. They should all be coming together as opposed to belonging to and being employed by the Department of Human Services. Does that clarify?
It does. So you are not in favor presently of creating a new unit of individuals that coordinate this outside of existing professionals. So you would be opposed to creating a new specialized unit that coordinates this.
That conducts it. I do expect that CDHS is going to have a couple of people that coordinate, like, hey, what are the rules? How are we gonna do this rules? Hey, somebody has to call the county sheriff and say, hey, sheriff, we need some bodies. Like, I do expect that there may be a group of people within CHS that has to do that management. But on Tuesday, when little Billy goes running, that's going to be a group of MDT, an MDT that responds to that, not this management group within CDHS.
Sergeant Carter, I think so I'm hearing what you're saying. I dropped in the language that's currently written around multidisciplinary. And so I'm thinking what you're saying is not like you're agreeing generally with this unit, but you're saying like the unit itself needs to be made up of these multidisciplinary teams. So it sounds like we just need to kind of flesh this language out a little bit more to specify what that actually means so that it's clear. Because when I'm reading this, it's like maybe it's a little too broad. Is that
I just want to be really explicit because we have talked a lot about the Texas model, and the Texas model was professionals who had some other experience in life who are hired and operated and managed by their Texas counties, their Texas statewide Department of Human Services. And that model I'm opposed to.
So let me just make one quick suggestion. So when we send the survey out, this language specifically is one that you can respond to. So if there's language that you feel like would make this more explicit, to your point, can you drop that in on the survey side, and we'll make sure that we can incorporate that in a meaningful way? Because I hear what you're saying. And I want to make sure right now that we're also staying high level out of the individual recommendation. So I think what you're saying is like a really specific piece, which is super helpful. So just make sure that when we do the survey that you drop in some language that might be helpful there, if that's okay. All right.
Thank you for that. Before we do that, I know that we had Elizabeth had her hand up and then took it down. So I wanted to make sure that we came back to you. And then we'll go to Janelle, and then I think we're going to close out for a break. So that we can make sure that we have time to get to prevention. Elizabeth?
So I was just going to make a quick point. We were talking about, allowing for use of force or whatever, but I think some of the ideas that we're going to talk about later, like I think one piece is shelters, or maybe having the option to take a kid, to the ER if they need to go there, or to some other place instead of returning them immediately to placement. Those options, if we can incorporate that into our recommendations, those options are going to help deter any need for use of force, right? Because if we can de-escalate and offer this youth some options, then they're more likely to go with us willingly. That was the only point I had.
Awesome. Thank you, Elizabeth. Janelle? If you're talking, you're on mute, Janelle.
I know, I'm sorry, I'm trying to figure it out.
No worries.
I guess I don't really have that much to say because I almost agree with 100% of what Brian Cotter said. Especially the part about reinventing the wheel. There's so many people in agencies, law enforcement, nonprofits, mental health things, all of that, almost like he says unit, I think task force. And so when it comes up to those different individuals that work in all of these, not recreating the wheel, I understand making a space for this to be created, but pulling those individuals from certain agencies to create them into that space, if that makes sense. I just feel like that would be better, and then everyone collaboratively work together. There are so many amazing task forces and MDD groups and all the other things out there that work so well together. I don't know why there can't be a space for this topic built up with that same model and make it work just as well. Yeah, sorry, my camera's not working, sorry.
Awesome, no worries. All right, I think, Jordan, do you have what you need? I'm just sort of making sure, and I'm losing, oh, there you are.
I'm just sorry. I'm just gonna make a quick request for the survey, Trace, because the recommendation as drafted really was on creating an individual unit with individuals charged with responding. Those are the models. And the MDT model, that task force collaborative model, is a separate, they're just kind of functionally will be very, very different. So Trace, if you could put in the survey, please, responses for which of these would be the preference, that would be helpful, because we don't have an answer on that and we do need to move forward. But They're two very, very different models being presented. And the intention behind the drafting of the recommendation, again, just taking what we had, we were forming it more on the Texas model. And so now I just need to be explicitly clear where we're hitting with the functionality of the unit.
Thank you, Jordan. And then, okay, so putting out before we go on break, one last time, anyone who have any overall dissent with the recommendation around a specialized investigations unit. Brandon, is that your hand saying yes?
Yeah, and I just again echo, you know, what some of the people were saying, like Dennis and Sergeant Carter. It depends on how it's structured, whether I would be dissenting or not. I agree with Officer Carter that, like, I would not support a system like Texas that is there. I don't think that that would be beneficial, that it needs to be more localized and managed from that standpoint, but in using our current infrastructure, I guess, would be my recommendation.
Thank you. Stephanie, put your manual hand again.
My manual hand again. Yeah, I don't want to be difficult, and maybe I'm confusing the issues. I thought that the question you were getting to, Jordan, is do we in concept approve of a group of humans coming together to respond to a runaway youth? And then I heard, and maybe incorrectly, that the real question is how that group of humans comes together and responds to a youth versus, in other words, is it going to be a state centralized approach? Is it going to be a local approach? Is it right with MDT? And I guess I'm just trying to understand the question to answer right now. I thought it was just in concept, this broad notion, and then we would work through the details down the road, right? Like, because obviously we can't solve it all now. So I'm just trying to clarify the ultimate question. And again, I'm hearing two different questions personally.
So the question I'm asking the group, because we have two concepts floating. So when Trace sends out the survey, my question is this: do we want a unit, whatever we name it, to be a specific set of employees? We literally hire them as unique investigators with a specific skill set solely to go out and respond when a youth runs away from care, like Texas and some of the other models we looked at. That's their model. They have dedicated staff who coordinate with other entities outside of them, but are not members of those entities. They're a centralized investigator unit. Do we want this model, or do we want a model where we create, pulling, as Sergeant Cotter said, employees from all these multidisciplinary entities who, when a youth runs, it's a standard response unit and they all have to come together and coordinate care that way? So do we want a dedicated trained staff who do this and then coordinate externally, or do we want multiple stakeholders to come together and respond in this way? Does that answer your question?
That answers for the survey. So provide that feedback in the survey. Verbally, for the purpose of closing out this conversation, is the question around whether or not there is any dissent to this overarching idea of having an investigative unit that responds to youth who run away from care.
Okay, thank you. That helps clarify it.
So Brandon, I just want to come back. I'm so sorry, I'm not trying to be tricky, but is your dissent located solely on if it's a centralized unit, but are you okay with the general concept of creating something that is a standardized unit of response?
Yes, I support, there needs to be something to help find these kids. All right. So I support that.
Thank you. All right. I don't see anyone jumping to come off mute. I don't see any Zoom or manual hands raised. So I think we are good.
Yeah, let's move to a break, not to just be abrupt, but we're gonna come back, and so thank you y'all for that discussion. again, the survey will be another opportunity for you to give detailed feedback into the different pieces. Let's break until 10. So still going to give you 14 minutes, but please come back right at 10 and we're going to get rolling on the prevention piece. Thanks, y'all. So we have, I don't see any members of the public, but if I'm missing anyone and anyone would like to provide public comment, please send me a note just so I can reserve some time at the end. But otherwise, we've got about 50 minutes to roll through the assessment tool side on prevention. So yeah, appreciate y'all. I know it's a lot to go through, but I appreciate you hanging in there with us. And we're going to do similar, where Brian, I'm going to give them the 5 minutes well, actually, I want you to do just a quick kind of overview, and then let's send them in with that context for the 5 minutes to review. So Brian, if you want to go ahead, and then I'll drop the link in again for folks.
Yeah, thanks. And I'll keep this real brief, but again, just kind of the way that Jordan did previously, just to give an overview of the state policies that we looked at. We looked at Georgia, Nevada, and Wisconsin as highlighted in the summary document. Those three, I think the unifying factor there was that those were post-run interventions that then had screening tools to deliver to the youth after they've run to find ways to put in preventative methods. Illinois, the example there was a runaway risk assessment user guide that was designed for use at the time of admission. So kind of like an after the fact approach and a before the fact approach. And I know that this subcommittee was interested in utilizing both of those. So the subcommittee had a good discussion about what this has looked like. Sorry, I should back up a little bit. I know you're going to be reading it, but this is for pre-admission and recovery screening tools from the Prevention Subcommittee. So I'll just skip forward to the recommendations. I know you're going to be having time to read these yourselves, but just as a very high-level overview of what each of these components are, which are not final, we're happy to have discussion and find ways to make these more useful or satisfactory to the group as a whole. But to run through them very quickly, we look at the recommendations come into contracting with a third party or a university to actually create and draft what these tools look like. The use of a pilot program to implement it initially, to learn lessons and then modify as the path goes forward to get it ready for statewide implementation. The use of evaluation components, again, to make sure that we're learning what's working best from the use of these tools. Some data considerations like utilization of the Trails system as a place to look at this, agreements for storing data, MOUs for data access and data sharing considerations. Also, the recommendations get into points on standardized training, so creating the training components so that staff are meaningfully using the tools that are developed, and then also monitoring the compliance and ensuring that staff are being that the tool is being used in practice. We have recommendations that specifically mention the use of trauma-informed practices and methods in the implementation of all of these recommendation bullet points. And then I think a large component of this was being able to use the info that's gathered in those tools to adjust the care, to basically learn lessons from the information that's gathered from the youth who have run away in order to adjust the care that they see to give them less of a reason to run away. And then finally, whether or not the Joint Technology Committee could be a partner in the implementation of such a tool. So just very high level, those are the points that we went into, which we'll be discussing for 45 minutes now. If anybody has any specific questions, or Jordan, if there's anything to add, I think we can just turn it over to you all to really read and dig into it. But
Thanks,
Trace,
Brian. Yeah, I'm gonna give you all, so similar to the other group, gonna give you 5 minutes. Again, we're kind of focusing on down at the bottom, the draft recommendation language. And then I'm actually gonna pull up slides and go through each of these so that we can kind of get through them in the time remaining. So we've got 5 minutes. We'll come back at 10:10 and go from there. Thanks. That's my timer. Okay. let's jump in, shall we? Doris, while you were going, I was like, I need slides, so I just made some really fast.
I picked up when you said that. I was like, this, you don't put together slides. I was like, okay, way to make me look bad.
No, I just was like thinking about how my brain, I'm like going between different screens. So maybe someone else is that way too. So just one up and with a quick PowerPoint copy and paste. Jordan's going to help me out because my Zoom is being weird on my screen sharing. So there's 12 recommendations as it relates to these pre-admission and recovery screening tools. We had a lot of great discussions in our breakout group and honestly a lot of consensus. So I'll be curious to hear from folks that aren't as familiar with this because you were in the other group. But also if we're, again, we're taking, and also special shout out to Ashley for joining Jordan and Brian and kind of helping, refine some of this into something usable for folks to respond to. So appreciate your time, Ashley. I know that was a lot. I think here, though, we've taken a stab again at all the different work that you all have done and put into something. So even the group that these are your recommendations, you might also, some of the language might have gotten it wrong or something. So feel free to jump in. But we're just going to go through these one by one. Oh, Jordan and Brian made it easy. That sounds about right. That tracks with my experience. So we're going to start with the first one. And similar to just Doris, we're just going to roll through each of these. Then we'll have a kind of a broader discussion at the end, both for generally speaking, like what might be missing or additional considerations we need to be keeping that you want us to make sure to document. And then, really that high level question of, do you agree or do you disagree about this idea of implementation of pre-admission and recovery screening tools, knowing that this is about the conceptualization of this, not about the implementation piece. So do you agree with the concept of this is the question that we're going to be asking at the end. So with that said, let's go through the first one and you can raise your digital or manual hand, Stephanie. I'll be looking for both. So number one, creation of a data/file system to ensure that a youth's response to the tools are stored electronically and are available for future placement. Is that the right? That's not the right.
That's not the first bullet point from that's on the second page. The first one, and we can do this however, just as long as we hit them all. But the first point had been the third-party consultant or university to create the tools.
All right, take my slides off. See, Doris, I just set myself up for failure there. All right, I'm dropping it into the chat. That's what I'm going to do. All right, securing a third-party consultant or obtaining services from an institution of higher education to develop a running risk assessment screening tool and post-running assessment tool. So I think really what this is around is the expertise of folks that actually create these tools, right? And ensuring that actually happens here. So any questions, additions, concerns around this particular recommendation? Stephanie.
Yes, I just have a question for our facility friends. When we were discussing these tools, many of you talked about there being a pre-admission process before youth go into facilities. And there had been some discussion about whether that process is very different than this tool would envision. It complements it. And I guess I just would love clarification on that, probably from Brandon, Becky. I'm looking around the screen, or even Dennis.
I would punt to Brandon or Dennis on that.
I'm sorry, I missed the question. I just got back on. I was running late.
Yeah, my question, Brandon, is just when we were having these discussions, facilities talked about there being a pre-admission process already, right? Before you come into your facility. And my question is, would a tool that assesses an individual's runaway risk be duplicative and enhancement? And it wasn't clear to me in our conversations. Overall, what I heard was it was an enhancement. But I just want to be clear before we recommend this.
Yeah, I think it's an enhancement. I think it highly depends on, again, what the tool's trying to accomplish. If it's just trying to identify the kid's a runner or not, I think, I mean, that's pretty obvious a lot of times that their reaction is. I think it's more about the circumstances that can be gathered around the context that around the runnings that would be helpful to put interventions in place, treatment in place that would help. So I guess it depends on what it's targeting, but I do think it would be an enhancement.
Okay, thanks.
All right, appreciate that, Stephanie and Brandon. And Dennis, anything to add? I know that she named you as well, so just want to make sure.
I think it would definitely be an enhancement for the provider. If we did it right, the provider could get really valuable information that they could use, particularly around in treatment planning. And then if we're going to have this other unit too, that's going to go find kids, this screening tool would be like an incredibly important tool for those folks as well.
All right, appreciate that. All right, moving on. I'm dropping in because my slides are trash. Number 2, conducting a 1-year pilot program utilizing the running risk assessment screening tool and post-running assessment tool to include X number of urban counties and Y number of rural counties. The spirit of this is a pilot is always a smart way to work out the kinks and whatnot, and not trying to roll this out on a grand scale level. Any questions, concerns, thoughts here, feedback? We love a pilot. We got even thumbs up. Thanks, Dave. All right, y'all. Moving on, number 3. Dropping it in.
Dennis has his hand up.
Well, Dennis, go ahead, Dennis.
I don't understand the need for a pilot. Like, why are we hesitant about just going? Like, if we had the tool developed, why do we need a pilot for it? Why can't we just implement it?
It's a fair question from the person who's at the state. I'm like, if you don't want to do a pilot, no, I'm curious to hear from the group. I know there's a, go ahead, Ashley, and then Stephanie.
I think one of the considerations was that we want to make sure the tool is high quality. And so this would be a way of it would be the second step of creating the tool. So the tool would be created, it would be tested this way, and then make sure that it's high quality before you win it across the state. That's sort of how I remember the conversation going, but I could be a little bit off because there was a lot of conversation about how this only works well if the tool is really reliable and high quality. And this was part of ensuring that.
I think there's also, I'll add 2 things too that I'm remembering now. One was like a feedback loop from impacted folks, especially providers, but also youth that are being impacted by like having to be someone that is participating with this tool. So like, is there an opportunity for co-design to kind of like refine some of that piece with youth voice as it's implemented? And then 2, I remember Michelle from Douglas County talking about just like actual implementation challenges at the county level, and for some of that to be worked out of like if it's actually utilized. And kind of to the point in a previous conversation around like just efficiencies of like other systems that already exist, working some of that out. So I don't know if Stephanie, if you want to, I saw your hand go up, and then David, you can go after that too.
I echo everything that has been said, particularly Ashley, your memory on that. The only additional thing I would add is that I recall a conversation that facilities wanted a partnership with the state, right? And that because this would likely be a requirement in regulation or rule, which falls under monitoring, which falls under licensing, that there wanted to be a partnership so that there was clear expectations around how that tool should be used, what results we should be seeking, et cetera. So I remember there a discussion about wanting to make sure we're solid on this and that it didn't result in further sort of miscommunication when we use the tool.
Thanks, Stephanie. David, go ahead.
When I think of a pilot, a 1-year pilot, I look at, you could almost combine recommendation 1 and 2 together I think doing the pilot is part of developing the risk assessment tool.
Yeah. We love efficiency, collapsing 2 into 1. We can give a stab at that. Great. Seeing a lot of head nods there, so that seems like it's resonating with folks. I think there's going to be, that's a good kind of lens also to just keep in general of like, if you see opportunities for some of these to just be combined into like to make it more efficient, definitely give us that feedback. But we wanted, I think, in the spirit of making sure that things were super clear and transparent, spelled each of them out, but I think there's opportunities to collapse them as well. All right, moving on into number 3. Gonna drop this in. Incorporating evaluation methods throughout and after the pilot program and enabling tool modifications based on evaluation and feedback in order to ensure an optimal program to potentially be implemented statewide after the pilot period. So, kind of in the spirit of what you were saying, I think this could be like a sub bullet maybe, if you kind of collapse 1 and 2, and this could be sort of the, the supplemental piece of the pilot, if that's what the group ends up moving forward with. But curious, that aside, curious to hear any feedback around the language here. And Doris, call on anybody if you see a hand up. I'm going between screens. Okay, hearing no hands up. Gonna move us on to number 4. Development of a system and trails to ensure that records and tool-related information are accessible statewide. Dennis, I'm going to pick on you on this one. How does this one land?
I was going to raise my hand.
Okay, perfect.
I think too, you have to build in a recommendation that the providers would have access to that in trails. Like I mean, there's ways you can build in accesses into trails, but I think the provider needs access to it.
Okay. Yeah. So a piece around access. Yep. Seeing, hand claps from Becky. We love it. So for this to be even like useful or true, like that would also have to be true. And that's an important piece, as will the special unit. We're connecting the dots. I'm loving this. David, go ahead.
No, I totally agree. I mean, I keep going back to the very last recommendation around this joint technology committee. I think that kind of goes hand in hand with how these different databases and things can share information or can connect to one another. I'm assuming that's kind of what that means. And because not all people, not all providers have access to trails, and I'm not all sure that we want everybody to have access to trails, but how would trails be able to talk to another database to make sure that it's in there? I don't know. I think technology will be a piece of how that kind of connection happens.
Yeah, and kind of the point that y'all are making me think about is that there might be a way, Jordan, to group these recommendations into the the main considerations. Like 1 is around access, 2 is around training, 3, I'm just spitballing, 3 is around like implementation, et cetera. And so like making sure so that it's super clear, because some of these it's like, 3 is going to make sense when you read 7 and they're all kind of connected. So we can kind of work to group those. I'm seeing some head nods there, so I think that'll be good.
Well, and I think that related to the grouping piece, across recommendations as well. So they're going to be technology considerations likely across all of the recommendations or most of them. They're going to be information sharing, kind of data agreements that are going to be applicable across multiple recommendations. So I think where there are those sort of higher level recommendations that cross some of the individual interventions, and I'm using interventions like sort of both for prevention and intervention folks sections, but I think we'll have to highlight those pieces and pull those up.
Yeah, I like that. Any opportunity to make things kind of like formulaic so folks kind of understand. And then obviously there's like outliers, et cetera, and we can name that in each piece. Okay, not seeing anything else on this piece, which I think actually gets at this next one. So again, knowing that we'll do some work to kind of like regroup these, I'm gonna still just keep that in the back of your mind, so we don't need that kind of feedback. But I think on the language piece, I'm gonna drop in number 5, and this kind of gets at some of that. So creation of a data/file system to ensure the use response to the tools are stored electronically and are available for future placements. I think one thing I might call out, because I saw Ashley say like, and the special unit, do we need to be a little bit more specific in that language, not just future placements, but there are other entities that you all are missing from the access to this information that would be in support of this child, in support of placements, in support of, any special units. I just want to make sure this is like spelled out enough. Is it just future placements, I guess is my question. So I'm seeing a head no. Who else? Ashley, maybe jump in.
I don't know exactly who it needs to be, but I think if we have these multidisciplinary teams, there's going to be something related to that we're going to have to expand the access to.
So maybe more just language that lends itself to, all impacted, or all, something that just makes it more inclusive of like who would need this access. And that would be on the implementation side for folks to spell out who that would be. But the recommendation is to ensure that access is the key issue here. Does that sound kind of, Ashley, does that maybe get at it? Without like diagnosing the issue, without knowing what exactly yeah. Anything else there for folks? Okay. All right.
Hold on, Trace. I do have a question.
Yeah, please.
If Trails is done in a way that it can share, is this necessary, or is this sort of like, if you can't have it all in Trails, this is necessary?
Say that one more time.
I'm wondering if this creation of a file data system separate from Trails is necessary if Trails can do the sharing that this is enabling or that this is envisioning.
Oh,
I
sure.
think it's agnostic as to whether or not that system is in Trails. So it could be for the implementation planning, it could be that this data file system that gets created for this purpose is housed in Trails, but it could also be somewhere else. But I think that's part of the conversation for implementation.
Yeah,
sorry to jump in, Trace.
No, that's helpful. I think it's a good point. And I think, again, kind of in the spirit of grouping things, I think we can kind of flesh that out a little bit more. When this next one also, I think, is a sub bullet. Now that I'm thinking, y'all kind of have my gears turning in. Jordan, I think I'm just throwing some things out there. So if this isn't tracking, but consideration of whether an MOU would be useful to enable data access, I think would be a sub bullet under the access piece that folks are spelling out. Go ahead, Dennis.
You're muted, Dennis.
I think it needs to be stronger than an MOU. I think it needs to probably be in part of the legislation that would create this to say that this will happen. I can give an example that the child placement agencies didn't always have access to look at unfounded cases of child abuse or neglect when they're certifying foster homes. But they ran legislation to get access to Trails to access that information. So if it's in the legislation, nobody can later then change their mind and say, oh, we're not going to do this, right?
Yeah, that's a good point. So stronger there. Okay. Anything else from folks? All right, this next one, kind of in the spirit, I think Jordan, correct me, is like around like kind of the feedback loop and how we're using this data to ensure that this actually isn't just in the spirit of that one child, but also like goes again to like kind of systems change efforts more broadly. So data sharing of results to develop better programs and responses. I think this is obviously one that we can, I'd be kind of curious to hear from folks around, if you could spell out just in the kind of a sub bullet manner of like, being more specific, because I think it's like, we're going to share the data. What does that mean? Where do we see opportunities for this being useful? I just think there's a lot of smart folks here in different arenas. So I'd be kind of curious if y'all could help generate that right now as a sub bullet piece to make this a little beefier.
I think one piece would be, determining or analyzing if there are patterns, if there are certain, we've talked a lot about reasons why kids run or don't run, and some of it is just guesswork. And if we had data and we saw some patterns emerging, I think that would help us develop specific tools or changes to, how we deal with things in a facility or whatever, but we just don't know that until we see the actual data. So I think that development of patterns will help inform future policy or changes that might be helpful.
Yeah, I like that. I think Doris jazzed it up a little bit right there with the continuous quality improvement process that incorporates the use of data. So kind of like calling for both to develop better programs and responses, but actually to your point, to ensure that we're actually noticing these trends and kind of getting ahead there. Go ahead, Stephanie.
Yeah, I mean, I think that, yes, they're sharing in real time, right? But I also think that, given the amount of resources that potentially would be required and would be invested here, I think there should be an annual report that is produced, right? Where we are putting out our data to the public. We report out to the state legislature that we're held accountable for the dollars and the thinking that goes behind this. So I would add somewhere a reporting requirement that references the data and the types of things that might be useful for the public to know and for policymakers to know as well.
Yeah, I love that. Thank you. Anything else on this one that's helpful? I think that'll make us kind of add some meat to that one. All right, moving on to number 8. This is something we heard like consistently, constantly, I think is also maybe something to even draw out, Jordan. And it's like I'm just thinking more of like what are the themes that are going to be across all these recommendations, right? That's standardized training, etc. So that's another way to kind of think about this. But as it relates to this specific tool, creation and implementation of standard training for those who will utilize the screening tool, I'm curious if folks, the thing here, if y'all are interested in adding more specific details around like trauma-informed training, or if that's something that is assumed in these spaces, or if there's anything that you'd like to see like making this a little bit more explicit, or is it good as is? Go ahead, Janelle.
I would never, ever assume that trauma informed is just in these areas ever.
All right, good. I love it. Doris, I see your hand shoot up real quick before we go to David. Go ahead.
I was looking back at the document, forgetting that you had it in the that you had put it in the chat. I mean, I think it's administering the tool in a trauma-informed way.
Yeah.
So
Well,
it's like there's the technical part of the tool, right? Like it just, I mean, I'm sure it's a series of questions and all that, and we'd want the tool to be trauma-informed itself, but also gathering the information, asking kids the questions that get at the information that goes in the tool will have to be asked in a way that is cognizant of trauma-informed principles and, doing so in a way that doesn't create more harm. So maybe it's administering the tool in a trauma-informed way. Just trying to offer a suggestion for refining the language.
Yeah, clarity of both the tool development itself being trauma-informed, which maybe goes in that first recommendation, right, of the development of the tool with a third-party consultant, et cetera. And then the clarity here that the implementation of the tool itself, or the actual use of the tool, is also from a trauma-informed approach like that. And that's a good, I think also maybe here, something I heard in the group, Jordan, so I'm just thinking, and now this is making me think that oftentimes when there's like training, like, I'm Trace and I received the training and I'm seen as the specialist in the facility. That doesn't mean I'm the only person though that then does the tool. It's that if somebody has a question about it, they'll come ask me about it. But really there's a bunch of people kind of going, freestyle using the tool, knowing that there was one person in the facility trained. So do you want to like clarify here that the person that is administering the tool has to also be the person that has received the training? Because I feel like that was something that came up in the group. So I just want to clarify that here. That may be something to spell out a little bit more, that it's not just one person in your facility or one person wherever has received the training, but the person utilizing the tool has received the training themselves. Does that track? Okay. David, then Dennis.
You know, I guess in my opinion, I wouldn't get too in depth on labeling out what every little training we're going to need, because I don't think we actually know yet. I think there's going to be a lot of it, rather to how to implement the tool, ensuring that people are maintaining the fidelity to the tool, and then really the information that's coming after you've done it. What do you do? There has to be a training what you do afterwards, like the information that's coming from it, to make sure you're implementing a good prevention plan. I think it is going to encompass a lot of things, to ensure that we got good information going in and good information coming out, so we can implement good quality plans. So I think there's going to be a lot more training than you can probably even think of right now when it comes to this type of tool.
Yeah.
Both on how to implement, how to conduct the tool, and what do you do with the information once it's done. I think that's probably the most important thing. Now, what do you do with it?
Yeah. And I think, not to just keep coming back to it, but I think I'm like, David, we're going to need you on the implementation side, because, right, like in making sure that then what is done with this as well. But I think speaking to that in this recommendation will be really helpful to reference that we know that this is just, again, the conceptualization of this tool, but on the implementation side, that will need to be considered explicitly. I think we can kind of break that out. Dennis, go ahead, and then I'll move us along.
Well, I was going to say a lot of what David said, but I also think too, like, we have to care for who's going to create the training. So I think that if we're going to engage with like a higher learning institution to create the tool, we probably need to engage with that institution to also develop the training as well.
Oh, yeah. Okay, good point. A through line of ensuring, yep. Versus me taking your tool that you created and then making sense of it myself. Yep. Anything else here? I think, David, some of yours kind of tease up this next one nicely. I'm going to drop it in. Number 9 is around the compliance kind of piece. It's not the implementation compliance, but just the development of practices for monitoring compliance with the requirements of the tool and related data entry. Any feedback, questions here, or clarifications you want to make? Okay. That one's pretty straightforward. Number 10. Oh, Dennis, go ahead.
Well, I want to see what Brandon Miller has to say about this, but from my perspective, you can't just have like one person at the provider that has like been trained and is reviewing these assessments. It is probably all of the line staff in the facility, because they're the ones working with the kids at the facility at the time that a child or youth may run. So it seems to me that, okay, I think it's written fine. I think we would when it comes down to writing rules and stuff, we'll care for that in a way that indicates that all the direct care staff are the ones that are trained, well, and therapists too, but that we're not leaving folks out. Like, there's not going to be just one person that's going to be trained.
Yeah. Yeah. And I think, Dennis, that's a good point too. Like you said, it's the recommendation as it's written is getting across the point here, but there might be a point in more the like narrative piece to ensure that when the implementation piece is considered, it's because of all the reasons you just named and then additional ones as well. So appreciate that.
I put a note in the chat similar to what Dennis was saying, again, going back to like the training part on, who gets trained. You could have a person who's like an intake person and thinking that that's the only person that should be trained, I think would be a miss, because they're not, to Dennis's point, the folks that are engaging with the youth on a day-to-day basis. And also, you gather information likely over time on a youth. So having all folks who are in a facility, who are direct care staff, trained on asking the questions and what to then do with the information, I think will be important.
Yeah. Thanks, Doris. Jenna?
Sorry, I know we're trying to wrap up. I'll just say quickly, I think some consideration for monitoring the compliance is if we're going with an outside party to create the tool and they create a training, could they do an ongoing or limited time period of consultation for those that are implementing it, so they can say, okay, tell me the last 3 clients that you did this with, let's talk about it. They're the experts in the tool, they've given us the training, and then they're giving us consultation. So that could be, I know that would be another cost, but that's a possibility as well.
We're not worried about cost, Jenna. I love that. Yeah. Yeah, some sort of like ongoing consultation opportunity. I'm not hearing you though in the evaluation piece though, right? Because it's like you don't want the person that created the tool to also be the evaluator in this case. So you're just talking more about consultation of implementation. Is that
Yes,
right?
sorry. Yep.
No, I just want to make sure I'm reading that right. Okay. Great. Thank you all for that. Recommendation 10. So the more I'm thinking about this as y'all are all talking, because this is again kind of in their spirit of grouping. I'm wondering actually, so incorporation of trauma-informed practices throughout the development and implementation of the tools. Janelle, I love your piece about we never assume that trauma-informed practice is a given. And so I'm wondering if trauma-informed practice, implementation, development, et cetera, is a theme across every recommendation, every tool, that is actually a recommendation that we pull out above all recommendations, right? As like this, and I'm sure there's a number of these, Jordan. So I'm just thinking of like trauma-informed pieces as a special call out, right? Of any sort of development, implementation, et cetera, tool that are within these recommendations. And then instead of having just like one trauma-informed piece, we use that language within each recommendation as necessary. So on the tool earlier, ensuring that it's trauma-informed, but we don't make this a recommendation within one individual one because it's a recommendation across all of them. Is that, I'm kind of hearing that from folks, so I just want to like bounce that out there as like we're not taking the trauma-informed piece out, but we're saying instead it's actually needs to be a special call out of recommendations across the board.
I agree with that, Tracy. And the reason I agree with that is because when we're talking about bringing different people in from different agencies or organizations to be able to build up, what this is going to be, you want people that are skilled in that. You want people that have been doing it for a while. You want people that understand what real trauma-informed care and, approach is, because I think a lot of times it gets muddied what it is. And so I think when you have that above all else, especially with these kids that are clearly high risk, clearly have maybe endured trauma, it's very likely, things like that. If they don't have that background, I don't see them being effective in anything else that they're skilled in when it comes to dealing with these kiddos or making decisions for them. That's all.
Thanks for that. Brandon?
Yeah, just to echo, what you said, I think trauma informed gets thrown around a lot, and it's so broad in a lot of aspects. I think, fundamentally, not just in this topic area, but across the state, there has to be a consensus direction around, what trauma informed is, the principles and the foundations and the education around it. Because I think a lot of times when you're dealing with crisis and these situations, you have a range of perspectives of what actually trauma informed is, and most people tend to have at least in my opinion, a fundamental misunderstanding of trauma informed.
Yeah, and Brandon, I think maybe with kind of what we're saying about pulling this out as like a broader, not broader, but as a more specific call out across all recommendations, there might be an opportunity to for this group to kind of make sure the language actually reflects a clear definition and kind of stat bar of quality when we talk about trauma informed, right? Like I think I could see you all kind of like leaning in on some language that's like, oftentimes trauma informed is used as a buzzword in this space, and this group wants to be clear that when they say trauma informed practices, we mean A, B, C, D, these sorts of things. So I think by making it its own call out, you could kind of get at what you're saying there. Anything else there before we move on? Okay. All right, moving on to number 11. Determination of how the information obtained from the tools may be used to adjust a treatment plan. So David, this is kind of what I think it was you that was getting at this. Obtained from the tools may be used to adjust a treatment plan for the youth while they are in out-of-home care. This should include possible interventions for a youth threatening or attempting to run away from care. So this is really getting at the, what do we do with it piece, right? And determining that actually needs to be spelled out, that this isn't just a tool that we say, here's a tool, but that there's also like language around specifically then what provider would then do with that information. How does this language land with folks? Questions, feedback, clarifications you want to make? Everyone's thrilled. Brandon, there we go. Brandon, go ahead.
Yeah, so I don't know if this is the place, and I know it left early last time we met on the recommendations, but clarity around interventions and whether that agencies and organizations have the ability, if exhaustion of all options and things, to stop kids, and is this tool going to be utilized to provide that information? I think kind of similar to the intervention, what we're talking about, the ability to physically stop kids, I think is a discussion topic that has to be not overlooked. I don't know if this is where that would fall under or not, but looking at the recommendations, I don't think that is clear in any of those points, that is a fundamental decision that has to be discussed.
Yeah, Jordan, I'm curious if you have a thought there, kind of standing on the balcony.
Brandon, can you just say your last point again? I was taking notes and I just want to make sure I'm following correctly before I respond.
Yeah, kids in crisis and that are trying to leave facilities, at what point and is there an ability, or should there be an ability for organizations to eventually just stop them from leaving and at risk, and and I think at the heart of it, in my opinion, that is one of the main points and focal points when we look at this task force. How do we prevent what happened to why this task force existed? And when you come straight down to it, it's how do we stop kids from leaving? And there has to be, similar to the intervention, a discussion. And I don't know, I'm not saying that it can't look different ways. And I'm an advocate that, we need to protect kids. And if that means that I gotta, escort them back, or, I'm going to, this is, a discussion that has to be, had. And I think it's the most critical point to all this.
Thank you for just restating that. I just want to make sure I was following. So yes, this will be a very big discussion that we have in this group. We have presently slated the discussion of what we're loosely calling restraints. But that's kind of this notion of physically stopping children and youth from walking off campuses for the Prevention Subcommittee in April. We've put that further out with the intention of getting some additional resources in. Brian has made some interesting contacts nationally to see what's being done. We've definitely heard this group as that will be a big point, and so we wanted to give it a little bit more space before we move into it. And of course, as we go through and write these recommendations, we'll integrate different parts, kind of how Trace has been discussing here. If that needs to come into recommendations as we write them for discussion in July, we'll certainly do that. So I really want everyone to rest assured, we're working very hard to set you up with a lot of resources for that conversation in April and then subsequently in May.
Yeah, thanks, Jordan. I think Bernie and I would just underscore it's like we know how often that has come up and how heavy of a topic and how and Jordan's point of like needing to do the research, but also needing to have the resources available for you all. So that one was by design a little further down the road. So okay, y'all. Last one here. And Jenna will make sure to make a note of your point as well. Consideration of how whether to incorporate the Joint Technology Committee. Any questions, clarifications, additional points on this? Okay. Do we know what this means? Does everybody know what this means? Jordan, can you give a quick? I'm seeing a varied couple. I just want to make sure that folks are clear on like what this is getting after.
And Brian, I'm sorry, I'm going to toss this one to you because I know that you wrote through this and were present for joint technology communication a little bit more.
I think just in those more fine-grained aspects of how the data systems talk to each other, or what would be involved in ensuring that interagency, interdisciplinary access to the information, just that this might be an entity to engage as a partner to make sure that that's done well.
Okay.
And this may have come in part from me too, Trace, because at the Child Welfare Interim Study Committee this summer, the idea of trails and some of the challenges there came up regularly. One of the things that committee did was issue a letter or request to the Joint Technology Committee to maybe look into this or work with it. And so it seemed like an opportunity, if they're going to be looking at this already, to kind of take advantage of that work or that conversation to see if this could be incorporated into whatever. And I don't know if it's going to go anywhere, but it just seemed like a good opportunity to try to get involved and see if some of the stuff we want to see happen can be part of that conversation.
Yeah. Okay. That's helpful. Thank you for that. Okay. All right. We made it through all 12. Yay. Again, on the survey, you're going to have an opportunity to give individual feedback to each of these. Should there be any sort of clarification you want to make or feedback, et cetera, that you want to make sure is captured. We're also capturing that just verbally. So if you've already shared that, don't feel like you have to circle back to that in the survey. With that, the clear question here is, for the record and for the purposes of the report, would anyone like to share any disagreement of this idea of statewide assessment tools moving forward as a concept of recommendations for this task force to include in the report? Okay, seeing none, we will move these forward. So with that, we will put these two topics to rest until July, when we come back looking at kind of the cumulative work that you all have done and really diving into the report. So really appreciate, again, all the work you've done, both in the subcommittees and also the folks that spent time over the holidays to help us kind of flesh each of these out. With that, I want to just name that kind of going back to the original roadmap point. So on the screening tools and on the special investigations staff, that was December and January. Starting in February, we're going to be moving into statewide policies for intervention group and hardware for prevention. So I can't emphasize it enough. You'll be receiving kind of continued resources, some that you might already have received, but also in addition and research and whatnot to be prepared for those conversations in February. So it is more important than ever to be reading our robust emails, if you will, to make sure you have access to those and you have time to review them ahead of the meetings. Anything, Doris, that I'm forgetting as far as that goes? I want to talk about a couple of other kind of logistics, but want to make sure I'm not.
We're good.
Okay, great. So with that, Stephanie, before I have you close us out, I'm going to drop in the exit survey for folks. And Sorry, 1 second. Stephanie, why don't you go ahead and share your thoughts as chair, and then we'll close it out with this exit survey.
Great. Just thank you, everybody. It is really evident that you all have been very thoughtful, researched a lot of materials, and I just want to say thank you for being here, being prepared, taking the charge seriously. I see a lot of movement in these recommendations, and even if, right, we run into some barriers and obstacles, which inevitably one will. There's a lot of progress here, a ton of progress here. And so it really excites me. I don't know. I guess I just want to say, I just think about Timothy, Elizabeth. And I just want to thank you in particular for being here with us, period. And your insight, I can't tell you how important it is. And I just want to tell you, and I think I speak for the group, that we're committed. We're committed to making changes. And so I look forward to working with all of you in the weeks and months to come.
Thank you so much. I appreciate all of you and all of your time.
We appreciate you, Elizabeth. Thank you so much for being here. Thank you, Stephanie, for those comments. With that, I dropped in our survey. I appreciate you all's time on that. There's also an option at the end for just some general feedback around facilitation, process, how we're moving through this. Please take the time to share that with us so that we can, in the spirit of continuous improvement, keep improving alongside you all. Thank you for your work and dedication, and we will see you back here in February.